Welcome to the Your Company Health Podcast. I'm your host, Andre Wright, founder and CEO of the Wright Consult Digital Marketing Agency, and also the creator of the Patient Buzz program. The goal of this podcast is to highlight healthcare professionals, their journey, and how they're making the world a better place. Let's dive in. Welcome to another episode of the Your Company Health podcast. My name is Andre Wright, and today we have Jason Raidbard, an executive administrator from UChicago. Hey, Jason, good day, and how are you?
Good morning. How are you?
I'm great. To get things started, so tell us about your background and your journey in healthcare.
Sure. I often, when people ask me this question, I have to now calculate the number of when I started versus today's date, right? And I did this recently at a conference last week that I spoke at, but I've been in healthcare for 22 years. Up until 3 years ago, before I worked here at the University of Chicago, I work as the executive administrator in the Department of Ophthalmology. I was in healthcare operations, pure operations, for 19 years. So I was either a practice manager or operations director. And folks can go on my LinkedIn page if they're interested. I don't want to bore people with the details, but I worked for mainly in physician office spaces. Some of them were privately owned. Some of them were public safety net hospital systems that owned ambulatory clinics. Some of it was a non-for-profit hospital, could be multi-hospital, could be one solo independent hospital owning medical groups. So that's where I was operations director or practice manager. And I did that for 19 years. So my roots come from operations, which, as you know, operations touches everything from HR to finance to strategy to you name it. Sometimes you are the staff psychologist, if you will, as one of my staff members joked about with me many years ago. But the last 3 years in this role, it's a bit more of an executive role where there's more decision making of the strategy. If we decide X, Y, and Z, I'm one of the people with my chair, who's a wonderful individual and a great executive to work for, Dr. Sinu Hariprasad. We work collaboratively to decide, okay, we get input and data and other things, but we collaborate like, okay, do we want to hire this number of subspecialists? Do we want to consider opening a clinic in this neighborhood or this market, right? It's more than that, but it can even be, okay, what capital equipment do we want to purchase and focus on because certain things are coming into life, right? So it's more of a strategic conversation rather than prior roles where I might be completing a budget, but I was focusing more on, I do budgets today, right? But in the past it was, all right, I have staff schedules. I need to make sure I have coverage. Okay, we're registering patients in the clinic. Are we capturing all the necessary data? Are we capturing all the co-pays, right? Whereas now I'm looking more at the reports and working with the management team to see, okay, do we see any trends? How can I consult and help? So often my nurse manager, I work with operations director, we joked about this when we all first met each other a few years ago, is that they look at me and I look at them. We work collaboratively, but my nurse manager often say, it's like having you is like having an internal consultant with all your experience. But one thing that I make sure that I do in this role is I'm not out of touch. I visit the clinic, I talk to the physicians, make sure we take care of what they need. Mm-hmm. So that operator in me has never gone away, but I just don't get involved in the weeds. But I love it. I enjoy it. This is a wonderful institution to work for.
No, of course. And Jason, where did this all start? All right. So, by talking to different healthcare, managers, operators, there's always some passion there. There's always some aha moment when you get into a specific field. So talk to us about that moment.
So for me, I think it was a little unconventional. I think now folks generally, they'll have their aha moment, maybe in college or maybe they'll in grad school when they go for their master's program. And then many of them go into a fellowship program following their master's. And there's a lot of dual programs now, an MBA, MHA, for those not sure, master's of business administration and then a master's in healthcare administration. A lot of times people get both at the same time. Then they go for a fellowship. When I first started, and we're talking the 2K era, that existed, but it wasn't as seen as it is today. I think fellowships are very competitive today. I think there was probably less people pursuing than openings even at one point, whether we're talking about the 90s or even the 2K era. I ended up, when I was in college, I thought I wanted to be a city manager. And I've always had a desire to help people. And I will tell you, the first time I vividly remember wanting to help people, and this is a personal story. When I was born, I was tongue-tied, meaning my tongue did not extend normally as it does. And there was something that needed to be clipped for me to be able to do it. Well, the doctor at the time said, he'll grow out of it. So my parents said, okay. It never happened. So when I was 6 or 7 years old, I had to go through speech therapy because I had a lisp. I didn't really want to talk. I wasn't very engaging because I was embarrassed by it. And we had the surgery to fix it when I was 6 or 7. And I went through, Mrs. Swanson was her name. I did 2 years of speech therapy with her. And that was the time that the first time I realized how vulnerable people could be based on something that bothered them. And for me, it was, I had a lisp, I had, stuttering because I was just afraid to talk because I couldn't talk the way everyone else did. And being in that environment, because we did group therapy, this was a speech therapist at our school. It wasn't a special place, it wasn't a special center. And a lovely individual. I think she was quite a bit older at that time. I'm sure she's since passed on, but I just remember I encouraged the kids as I got better and felt more confident. And I think it's just that desire to help people. Now, I thought in college that desire was going to be being a city manager and making sure a city was, economically thriving and that garbage was picked up and things were taken care of and your town would be nice. And even though I went through an internship and even a master's degree towards it, I never fell in love with it. I still loved working with people. But the technical pieces of it just didn't make my heart sing. So I met a doctor by chance on accident when I was in grad school. And he offered me a position to run his clinic, which at first was really just me and him. And then eventually within a few months, medical assistant, because he had been retired and then he came out of retirement. He's like, I want to start over again. He was in his upper 60s at the time. So it was totally like, okay, I'm kind of bored with this, so we're going to put this off to the side. I'm going to try this healthcare thing. And I loved it. It was different every day. It was crazy sometimes. And just what I enjoyed the most about it was two things. The building up of the business part, seeing it grow, much like a plant. Like I'm a gardener now. Like the last 10 years, I do home gardening, right? Seeing a plant or a flower go from a seed to a flowering plant of any kind or a tree. Seeing that part and being a contributor, that was fun for me. That was like better than a video game, right? It was just like you were able to see something grow. You started from nothing and now you have something, right? And that kind of spoke to my entrepreneurial spirit. But the other part of it is I would see people come in sick and leave healthy. And so the two of those kind of married together is what made me fall in love with healthcare. And if that answers your question, that's how it all kind of started. It wasn't like at 7 when I was going through the speech therapy, I knew it was going to be healthcare. I just knew I wanted to help people. It just translated into that years later. Life has a way of taking you. I had someone very much smarter than me tell me this. It's much like water. It's going to go wherever it's going to go. Life's going to take you. You can have an idea, but sometimes, and I didn't know at 24, 25 years old, life was going to take me there, but it did. And I look back on it now, all the years that I've worked, and hopefully I've left things in better shape as I've worked with different people than the way I encountered them from day one. And I think I have. But it has been a wonderful way to give back.
Yeah. And that's awesome. A bit similar to my story, because with digital marketing, I like to help doctors grow, and I like to help people. Also, people, I help doctors help their patients, which is really a big thing for me. So great story, and I can see why you're passionate about what you're doing. But Jason, in the interest of time, the buzzword nowadays is AI. Right? Artificial intelligence. How do you see AI impacting your space?
So a lot of institutions use AI, like clinically speaking, will use AI as a supplement. So I know there's a lot of folks that get scared of it because they're afraid that AI is going to be the doctor or nurse or the APP that's going to diagnose me, right? Where I've seen it, and it's incredible, that what it's done is that you can have a number of radiology studies, and the AI system that a health system can subscribe to and have can review all those different studies and provide support to the radiologist reviewing the study. As an example, right? The radiologist will always review and come to their own conclusions, but to be able to get another set of eyes, AI, if you will, no pun intended, to be able to look at it and provide some feedback, I don't think there's many clinicians that would say this is bad. I wouldn't say that AI across the board, we've all used ChatGPT and other apps like that. And, sometimes you get varying degrees of success or fail. But the ones that are part of health systems, they use it as part of their EMR, and part of that usually are very robust. They're narrowly focused on certain conditions. And I think when you're talking about radiology or pathology and some of these things, I think you're going to see it over time expand to provide more support. Because I think, one of the things that helps is that right now, we don't have enough in the United States, enough physicians.
True.
And while there has been a opening up and an increase in the number of PAs and nurse practitioners, APPs, there's still not enough. So when you have that, to have a tool to be able to help you, it's not going to fix the issue at the root cause. Personally speaking, I think the only way you're going to fix that is really by Congress deciding to add more resident slots, which haven't been updated in probably 30 or 40 years, so that we have more residents coming through programs to be able to provide medical care, right? And probably increasing funding for those that want to be PAs and NPs, exposing that to kids at an early age, that this is something that you would want to do, and making it easier for them to access it, so they're not drowning in debt and things like that. That's a whole conversation in of itself. But for the here and the now, you have the technology, if it helps ease some of the response times, because sometimes people are critically ill, and if you can get that response time down, that can literally be the difference between life and death. If it helps, then it's a good tool, right? I'm not a clinician by trade, but I've heard positive reviews anecdotally from clinicians. But I do know there's many health systems, good health systems, that use it in this capacity. But it's support. It's not necessarily, people think that AI is being doctor now. No, that's not, to my knowledge, that is not occurring anywhere in the United States, anywhere. There's not a computer in an exam room while you're in there taking your blood pressure, telling you what's wrong with you. Will that day ever come? I don't know.
Yeah.
I may be dead and gone by that point, but whether it comes or not, today, no, that is not the case.
Yeah, and I tell people all the time, AI is not here to replace people. It's a supplement. Just so what you're saying, it enhances processes. So the people who will survive in the future are the people who know how to utilize AI. So if you know how to use this, then your organization is gonna scale in the right way. So it's not a bad thing. Obviously, it's gonna replace some areas, like maybe designing and stuff of that nature. Some areas that this like tools like ChatGPT can be useful. But overall, I think it's a help. It's a good thing.
What I would tell you, kind of to close the loop on my thoughts on it, is that one thing that I often tell people is that most of the time you hear what you hear about anything. Change is hard for humans in general, right? Doesn't matter who you are, where you live, what you look like. Change is just, it's different. We're all used to routine and certain things. And yes, there's a select number of people that thrive on change. They like the right. But majority of people, if we're just talking about the majority of the world, they like to know that things are in a certain order, right? And when you disrupt that order, how many times do you go to the store and your favorite product is no longer there, or they changed the packaging and you can't find it, or you go to a restaurant and they no longer have that item on the menu, and you get, they can't leave well enough alone and stuff like that. But ultimately it's because people don't like change. And a lot of times, honestly, that favorite meal was my favorite meal, and I'm
Yeah.
still upset that it's not there, right? So we have to acknowledge that those are true feelings, right?
Mm.
But I think for AI in this context and conversation, it's important to understand that yes, it's new. New can be scary. New can be also good too. It's no different than when I was, growing up as a kid or even with my own child, getting them to try different foods from different parts of the world. Try it. Try it at least once or twice. If you don't like it, then okay, we can move on to something else, right?
Right.
But you can't just eat pizza and chicken fingers forever, is kind of what I say.
No, there you go. And a very important thing with AI, nothing can replace the human touch.
Yes, correct.
Nothing can replace that. So we'll always be here to advance processes. To get things going, Jason, look into as we were talking about AI, the next 10 years, what are you seeing? Talk to us about some of the development in healthcare the next 5 to 10 years. I know we spoke about AI, but what you could go any direction you want from a policy or from a, just natural advancement. What are you seeing?
So I think there'll be hopefully a natural evolution in preventative care. I think, I started in 2003. By 2008, 2010, 2012, most systems, physician offices, health systems were moving from paper charts to electronic charts. Okay. And then we've seen an evolution of those electronic charts, which were they're not perfect, but they were very cumbersome, right? So you went from a place of, in 2005, my doctor scribbling on a sheet of paper their soap note, to now you have systems that can listen, the AI system, while the doctor and you are talking. Now the poor physician doesn't have to sit and type and stare away from you because the construction of the room and where the computer is located. And you can have a more personal conversation than you did when EMRs first started, right? That's something I didn't think was going to happen this quickly. I went to a conference, MGMA Nashville, in 22 or 23, I think, 23. And they were talking about it then, and it's in use today, right? So part of it is almost unfair to ask me like what's going to happen in 10 years, because in 2, 3 years time, we went from like this testing phase of this type software to now it's in use and not in pilot, like it's full on. Microsoft and other companies are selling this. I think you're going to see hopefully more investment in seeing how genetics can impact not just we think this person's going to have X, Y, or Z condition because of this, but even have something of how do we prevent it? And that might be a little longer than 10 years, but I'm hoping that preventative medicine and preventative care is more than just explaining to people what a well-balanced diet is and what, vitamins you should have, and just not just checking your blood levels regularly, that it will be how early can we get to kids?
Well,
These are some of this is a little bit pie in the sky. I'd love to see enough funding to support people having access to whole foods that they can't afford. As simple as it, I don't know if that's going to happen, but I would like to see some of those preventative programs. I think that would be, for me, the next evolution if we're talking about preventative care, right?
Right.
Whether it gets public policy backing and funding is another, that's a whole nother podcast.
Yes, yes.
But I think that's one thing. I think you'll see AI used in a lot of other areas. I remember a couple of years ago, I was at a Becker's revenue cycle 3 or 4 years ago. And they were even talking about how they were going to use AI to more efficiently staff clinics and OR rooms with staff than a person like me could. Also for the purposes of scheduling appointments so that there's no human error and missing slots. And I remember years ago, and it still happens today, you could have slots every 30 minutes or every 15 minutes and someone misbooks it, and now all of a sudden there's 10-minute gaps. That's lost patient accessibility and revenue, right? So I think you're going to see that evolve and become more normal part of healthcare. Beyond that, I do think that a lot of the EMR systems, I'm hoping they evolve to where they're more not just patient-centric, but I hope they're more physician-centric, because I think the biggest fault of EMRs when they first came, it was going to be this great way to make physicians' life and nurse practitioners and PAs' lives and staff life easier. And I hope there's a concerted effort to continue to talk about wellness of our staff, frontline staff, We talked a lot about it during COVID, but then when COVID got better and everyone, we came, out of that wave, 22 and 23, we kind of stopped talking about it. But healthcare is still very, very difficult and not just laborious in nature, but it's stressful.
Yes.
It's not like you're working at a hotel or a resort and everyone's on vacation. And generally speaking, most people are happy they're there. They're at a beach holiday or they're in a mountain resort or something like that. Most people come in healthcare, they're miserable and unhappy because they're sick, and naturally so. And when you're taking that in, I hope there's still continued efforts that evolve over the next 10 years to make sure that we have enough mental health care accessibility
Yeah.
for everyone.
Yeah, and that would be great. That would be great, and I hope so too.
But again, these are more of, you're asking me like there's technical things and then there's my pie in the sky wish list.
I know. It's a lot surrounding this, and I know you gotta jump shortly. But talk to me about this, all right? Let's talk about practice management. A doctor is listening. They have a private practice, and they're looking some ways to grow at this point. As we are seeing in the market, there are a lot of private equity firms. They're buying up all these local practices. Uh, if you could give some advice to a local doctor, what are some ways they can position themselves and survive in this environment?
So I think the most important thing is they've got to look at their own internal processes and their own business. And hopefully they either have someone on their team, whether it's an external consultant or their practice manager or whatever the case may be, or themselves, where they can assess the financial viability of that practice. So what is the health of that practice? Are you hemorrhaging patients? Are you hemorrhaging money? Are you able to keep up and recapitalize? So you're able to put enough money away at the end of the year so that you can replace outdated equipment? Are you able to keep up with malpractice costs? That's usually the one major concern of a lot of private physicians. Are you able to negotiate fair rates from the payers? Because there are some states in the United States where you have a whole host of physician clinics throughout, private, hospital-owned, but then you also have a number of payers. Some states, there's one dominant payer, and it's like take it or leave it, right? So that can change things too, as far as what you're going to get reimbursed. If they feel that they're viable, I think they just have to understand and this is not something I can give them advice on. What do they want to be when they grow up? What do you want it to be? Do you want to be a multidisciplinary practice? Do you want to make it a single specialty big practice? Do you want to make it big to the point that you can sell it one day? Do you want to make it big because you believe in the private practice and the importance of it, which I think is, even though I work for a health system, I still think it's very important to have private physicians privately owned, right? Whatever it is, even if you're thinking about selling to private equity or a health system, if you're at that stage, you have to understand what is the culture beyond the finances of what you're going to enter. Or you're nearing retirement, you're going to sunset your practice, and then you're just going to be done with it, right? You have to answer those questions. There's a laundry list of questions. We could go on for quite a bit that you have to ask yourself, which direction do I want to go? And you have to ask yourself, why am I going that direction? Some people may be like, I just want to cash out. I'm done.
Yep.
I'm exhausted. I want to do something else with my life. Some people just like, I want to build a business and see it grow. And these are the things that I want to do. You have to surround yourself with good experts, people you can trust, whether it's an attorney, a CPA, whether it's, like I said, there's consultants around. They're not always from the big firms. There are small to medium consultants you can find on LinkedIn. You can find through their own physician networks. I'm sure there's similar physicians they work with. You can also ask fellow colleagues in your industry, how did selling to said health system or private equity, how did that work out for you? Are you happy? And don't just get one, get multiple. And you got to add that all together and then see, is it the right fit for you? Which direction?
Yep. But all right, well said. There's a lot of consideration around, growing a practice, and you lay that out excellently. I know we're up on the time. Jason, thank you so much for stopping by. Appreciate your take, and we should definitely, get together again.
Happy to get together again. Good luck, Andre. Thank you so much for your time.
All right, thank you so much.
Bye now.
All right, bye. Thank you so much for joining us today. I hope you found this information useful. Please share this episode on social media and also visit our website at andreewright.com/podcast for more. And also leave us a review on Apple or wherever you get your podcasts. Until next time, see you then.